I'm Bob Desnick. I'm a medical geneticist. I've been working at the Icahn School of Medicine at Mount Sinai for 50 years. I'm the Dean for Genetic and Genomic Medicine, and I'm delighted to be with you today. The program for Jewish genetic diseases began after the first disorder, Tay-Sachs disease, had a test for carriers. Carriers are the normal individuals who have the gene mutation, and when two carriers come together, with each pregnancy, they have a 1 in 4 risk of having an affected child. Once we had a new test in the late 1960s, testing began in the Baltimore, Washington area by a good friend of mine, Mike Kabak. He was testing for Tay-Sachs disease because he had a family that had a child with this devastating disorder, and he began to develop the testing. Dr. Kabak was a good friend of mine, and he shared that information with me, and then I said, great, I'm going to do it too. And we set up and we screened. At that time, I was at the University of Minnesota, and the Jewish community in Minnesota was only 35,000, and we screened more than 5,000 individuals and identified about 1 in 25 unsuspected, unknown, that they really carried this risk gene. The other aspect of this is once the test was available, we could do prenatal diagnosis. We could tell very early in pregnancy if the growing fetus was affected or not. When I moved to New York, we set up a program. First, we set up a Center for Jewish Genetic Diseases at Mount Sinai. That was in the 1980s. Fundamental to the success of this program is education. First, you must educate the physician community and get their support. At the same time, you must educate the rabbinical community and get their support. We were the beginners, but now it's widely accepted throughout the United States, Israel, Europe. The impact of carrier testing was dramatic. In the United States, there were 50 to 60 Tay-Sachs babies born every year. Once testing began, that number started dropping. There was a ward, a Tay-Sachs ward, at Kingsbrook Jewish Hospital in Brooklyn that had 25 kids suffering from Tay-Sachs. And today, that ward is gone. So the only time that we have a Tay-Sachs baby born in the US is either somebody didn't get counseled properly, particularly an intermarried couple. They thought the risk was very low, and that's not always true. These diseases, when a couple comes, you should screen the Jewish member immediately because the Jewish member of an intermarried couple is at risk. If they're a carrier, then it's very important that you screen their partner because it is a surprise sometimes that maybe in the past they had some Jewish blood, or maybe they just had that disease carrier status. So it's very, very important to reach out. It will be the success of your program, because if you don't screen for them in the Jewish partner first, and then in the non-Jewish partner, you'll miss some. What we did at Mount Sinai, first in 1987, we developed multiplex screening. We screened for 3 diseases that were prevalent in Ashkenazi Jews: Tay-Sachs, Gaucher disease, and cystic fibrosis. 1 blood draw, and we could test for them all. So it was very exciting. And it was well embraced in the Jewish community. And in fact, the obstetricians would see the woman, they'd identify she was pregnant, and they'd immediately have her go for genetic counseling and testing. They said, it's the only insurance you can get for having a healthy baby. And that was so convincing that as we expanded the tests, more and more people came for testing from the different Jewish communities. We reached a point where it got to be 40 different tests. 1 blood sample, 40 tests. And at that time I said, we should go beyond the Jewish community. We should include all the nasty, devastating, neurodegenerative, debilitating disorders of childhood. And we should include those in a single test. 1 blood draw, 280 different devastating diseases you wouldn't want to have a child with. And that's the status today. I've traveled in Sao Paulo. I've been all the way to Punta Alegre. I've been all over South America. You have superb doctors, superb medical care. We need the leadership, of course, to make it a reality. But I encourage you to begin the screening. The Jewish community is so health aware and so health oriented that you can guide the rest of the country by showing how effective genetic screening can be. And you will guide the rest of the country into accepting the vaccines and moving us forward. So much misery, so much pain from these diseases and these infections. We need to conquer them, and you are empowered to do that. So my best wishes, and I know that the physicians in Brazil have taken this on. I've known Daphne Horowitz for, 30 years, maybe when she was a young girl. But I've interacted with the physicians there on many, many occasions, and I look forward to your success with the Jewish genetic diseases. And thank you for the opportunity to talk to you and tell you a little bit of my history and the history of developing these programs in the United States, which I'm so proud we have done. Thank you again, and best of luck.